Assalamu alaikum, good morning. This is Dr. Malad Agastani. Today, inshallah, I will explain to you how to interpret the hematological lab test in an easy way. First of all, you need to know more about the history of your patient. Then you need to do the physical examination and mark the abnormal signs in the patient. After that, you can go and order the investigations. طيب, history taking. In the history, the patients can come to you with most common complaints of the hematological problem. I can divide this complaint to the three parts: RBC's abnormalities, WBC abnormalities, and platelets abnormalities with the clotting factors. طيب, in the RBC abnormalities, the patients can come to you with tiredness, fatigue, weakness, shortness of breath, and palpitation. And also the patients can come to you with jaundice. Don't forget this point. تمام؟ طيب, for the WBC, the patients can come to you with the history of recurrent infection. تمام? For the platelets, abnormality in the platelets and the clotting factors, the patient can come to you with the history of easy bruising, skin discoloration, and bleeding from the nose, gums, and joints. Then you need to go and do physical examination, and this physical examination. This is an examination, head to toe examination. So you will examine the patient. You will examine the full body of your patient. طيب, بعد كده we have the investigations. In the investigations, I can divide it to two types of investigation. عندي blood investigation and bone marrow investigation. طيب, in the blood investigation, what do you want to order for your patient? Usually and most commonly, we will start with complete blood cells, اللي هو CBC. Okay, in the CBC, you need to check the number of RBCs, WBCs, platelets, and also WBC differentials, and the hemoglobin, MCV, MCH, and all of that. طيب, after that, you need to do the blood smear or the peripheral blood smear. So what do you want to in the blood smear? You will take the blood sample and you will put it under the microscope, and you need to comment about if there is any RBCs inclusion problem in the nucleus and about the shape. After that, if you need to order for the hemoglobin electrophoresis. طيب, the other tests, this is for the bone marrow, and it is a bone marrow aspiration. What you will do, you will aspirate fluid of the bone marrow from the posterior iliac crest or from the sternum. And what you will do some tests. These tests includes cellular morphology, flow cytometry, cytogenesis, molecular studies, and إلى آخره. Okay? Now I will start to explain about the CBC. طيب, in the CBC, first of all, you need to check the number of the RBCs. RBCs number. It can be high and it can be low. If it is high, so it is polycythemia. طيب, what is the causes of the polycythemia? It can be one of two. يعني ممكن يكون physiological or pathological. Physiological like what? Physiological things that lead to a high number of the RBCs. زي شو؟ زي smoking, يعني the patient smoker, okay? Or the people who live in the high altitude area, okay? يعني عندنا smoker or اللي living in high altitude area. طيب, pathological like what? If the patient has any respiratory or cardio problem, أي more information about this, you will take it إن شاء الله next years. Okay. طيب, this is if the RBCs is high. If the RBCs is low, على طول go and check the hemoglobin. تمام. If the hemoglobin, طبعا if the RBCs is low, the hemoglobin will be definitely low. So الهيموجلوبين هنا low. تمام. So if the hemoglobin is low, go على طول and check the MCV. After that, I can divide the MCV to the 3 parts. ممكن يكون less than 80, or it can be from 80 to 100, and ممكن يكون more than 100. If it is less than 80, so هذه microcytic, micro, this is normal, وهذه macro. Okay, تمام. What's your differential if the MCV of your patient it is less than 80? عندنا 3 differentials. I can put it in the mnemonic. اسمها mnemonic هي set. Okay. Sideroblastic anemia, والI iron deficiency anemia. بعد كده عندي thalassemia. Okay. You need to put in your mind sideroblastic هذه جدا rare. Okay, I will not talk about it now. Iron deficiency anemia, this is very common. تمام. وthen عندي thalassemia. In the thalassemia هيكون في شيء يساعدني in the history, the positive family history of the thalassemia. طيب, after you find the MCV it's low, so you will put all this differential in your mind. Then what you want to go and check in the lab test, you will go and check the retics اللي هي the number of the immature RBCs. If the number of the immature RBCs is high, so that means إيش؟ thalassemia. Okay. If the number of the retics is low, so it can be iron deficiency anemia, or it can be sideroblastic anemia. هنوقف التست كده؟ لا. You want to confirm your diagnosis. If it is iron or if it is thalassemia, what you will do? For iron deficiency anemia, you need to order iron profile, and it includes you ferritin, transferrin, total iron binding capacity, and iron, of course. Okay. طيب, for the thalassemia, how you will confirm it? By hemoglobin electrophoresis. I'm sorry, the space شوية ضيق عندي, بس إنه I want to cover all the points in the same paper عشان كده. تمام كده؟ Okay. So to confirm the thalassemia, you need to do hemoglobin electrophoresis. For the iron deficiency anemia, you need to order for the iron profile and check the ferritin, transferrin, total iron binding capacity, and the iron. Of course, if the patient has iron deficiency anemia, what you will find إنه iron level is low. طبعا الفيريتين low, iron level low, transferrin low, but the total iron binding capacity هيكون عالي جدا لأنه there is no iron to bind with. تمام كده؟ So I finished with the microcytic anemia. Okay, so now for the normocytic anemia. يعني إيش normocytic anemia? That means that it's a low hemoglobin, but the MCV it is in between 80 to 100. يعني the size it's in the normal size of the RBCs. طيب what's your differential? You will think about what? You will think about 5 things. رقم 1, it can be hemolytic anemia, and the example for hemolytic anemia, sickle cell anemia, and G6PD deficiency, G6PD enzyme deficiency. تمام. What else? Think about blood loss. There is a bleeding from مكان ما, okay, and the patients come to you with some symptoms plus low of the hemoglobin. طيب, it can be leukemia, and you need to know that in leukemia هتكون دايما pancytopenic. So there is a low in the hemoglobin, and also there is another elements, and the test will be low. Okay? طيب. And it can be anemia of a chronic disease like rheumatoid arthritis. ليش? Because the chronic inflammation can suppress or inhibit the RBC production. وآخر واحدة, it can be iron deficiency anemia in the early stage. طيب, what we will do, أنا رقمتهم هنا 1 2 3 4 5. Okay, what we will do, the same as microcytic, you will go and check the retics. Okay, if the retics is low, so معناها شو؟ معناها there is low number of the immature RBCs, the same as هنا. So number 5, it is iron deficiency anemia. Okay, so what else? Leukemia. Okay, leukemia that lead to the increased number of the leukemic cells, the WBC, but there is a low number in the RBCs, and this is low number of the RBCs not affect for the retics. Okay, هذه رقم 3. What else? Anemia of a chronic disease. Okay, so 3, 4, and 5. If it is high, the rest, hemolytic anemia and blood loss. تمام. What you will do next? طبعا, I want to confirm all of these. So, for the sickle cell anemia, I will order hemoglobin electrophoresis. طيب, for the G6PD, I need to order to check the enzymes. Okay, enzymes deficiency. تمام. For the leukemia, of course, I will go and check the WBC number plus the WBC differential. Okay, anemia of a chronic disease. If the patient has some symptoms of the rheumatoid arthritis, I need to order for the test that confirm rheumatoid arthritis. Tamam. And also you need to order the inflammatory markers because it is inflammation. So عندي inflammatory markers, and this include what? Includes CRP plus ESR. Okay, for the iron deficiency anemia, again you will order what? Iron studies or iron profile. Okay. Okay, I forgot to talk about the blood loss, how you will check about it. You need to order for the stool analysis, and also endoscopy and colonoscopy. You want to check if there is any upper GI bleeding by do endoscopy, and if there is any lower GI bleeding by do the colonoscopy and the stool analysis. Okay, for the macrocytic anemia, إيش يعني برضو macrocytic anemia? That means hemoglobin low, MCV, the size of the MCV is very large. Okay, so you will think about 2 things. It can be non-megaloblastic anemia or the megaloblastic anemia. I will cover only the megaloblastic anemia. So your differential, it can be vitamin B12 deficiency or the folic acid deficiency. How you will confirm your diagnosis? عن طريق you will order or you will check the vitamin B12 serum in the blood, and also check the folate serum in the blood. Now we finish with the RBCs. After checking the RBCs, we will go directly and check the WBC. The WBC برضو we have low WBC number, or it can be high WBC number. If it is low WBC number, it is a leukopenia. leukopenia. What is the causes of leukopenia? ممكن يكون عندي bone marrow destruction. It can be HIV, and it can be lymphoma. These causes, this is the most common causes that can lead to leukopenia. طيب, high level of the RBCs يعني ايش؟ يعني leukocytosis. What is the causes of leukocytosis? حلو, عندنا infection. We have inflammation. عندنا bone marrow tumor, and عندنا leukemia. The third thing we want to check it in the in the lab test, the platelets. In the platelets, it can be نفس الحكاية برضو. It can be low number and high number. If it is high platelets, اسمه شو؟ thrombocytosis. What is the cause of thrombocytosis? It can be because of يعني post surgery, and there's any bleeding inside. Okay, and if there is any inflammation. Okay, and if it is low, so it is thrombocytopenia. What is the causes of thrombocytopenia? عندنا واحد, and we have 2. Okay, it can be because of decreased production. What is the cause of decreased production? عندنا bone marrow failure, or it can be بسبب megaloblastic anemia. الحاجة الثانية ممكن what else إيش في عندنا increase destruction, في تكسير كتير بسبب 2 platelets disease اللي هو TTP and ITP. TTP, it is thrombocytopenic purpura. ITP, immune thrombocytopenic purpura. Okay, for the leukemia معناها we have high WBC but low RBCs and low platelets. Okay, يعني patient complain of anemia and thrombocytopenia. تمام. لكن لازم تعرفوا إنه high WBCs, this is an immature cells. Okay, so it's not functioning well. تمام. طيب, عندنا 2 types of leukemia. We have chronic leukemia and acute and chronic leukemia. Okay, so I will start with the acute leukemia. طيب, لازم تعرفوا إنه it is severe. It's a severe type. Okay, وعندنا myeloid and lymphoid. So it is رقم 1 هيكون acute myeloid leukemia and acute lymphoid leukemia. Okay, طيب, both of them acute. If you go and check the lab test, you will find the blast is more than 20%. Okay, طيب, طبعا معروف على أي blast, بمعنى إنه you will find lymphoblast more than 20% in the ALL, and you will find a myeloblast in the AML, it's high or it's more than 20%. Okay, طيب, كيف ما أفرق ما بينهم في other test? ALL, it happens in the children. Okay, and in the lab test you will find low number of neutrophils. Again, put in your mind إنه WBC عالية, so we have high WBC, but you will find إنه number of the neutrophils is very low. Okay, طيب, in the AML I want you to take a sample again and put it under the microscope for the peripheral blood smear, and what you will find all roads. Okay, for the chronic leukemia, again same as the acute, عندنا myeloid and lymphoid cells. So in the CML and the CLL, chronic myeloid leukemia and chronic lymphoid leukemia. إيش الفرق ما بينهم and what's the difference between the chronic and acute? We will find the number of the blast is less than 20%. I mean, myeloblast in the chronic, it will be less than 20%. Lymphoblast in the acute lymphoid will be less than 20%. This is number one. Number two, CML, it happens in old age. Also in the CLL, it happens in the old age. تمام؟ يعني both of them in old age. إيش كمان؟ In the CML, we will find إنه total WBC is high and the neutrophils is very high. Okay? شو كمان? You will find positive Philadelphia chromosomes in the CML patients. But in the CLL patient, if you took the sample and put it under the microscope for the peripheral blood smear, you will find smudge cells. Okay?